A mother or father's wish for his or her child. That he or she is happy, healthy, able, and will achieve his or her full potential. Even in the face of disabilities, these aspirations are affirmed with extra care and the outpouring of love in support of children with special needs. And the children themselves, some not able to freely move due to a condition known as spasticity, have strong faith in their abilities. Spasticity, or muscle toning, is a type of muscle stiffness seen in children with neurological conditions such as cerebral palsy.
Cerebral palsy is a name that describes a group of conditions where there's injury to the brain, the developing brain, that occurs during pregnancy, in utero, at the time of delivery, or up until 3 years old. And it affects a part of the brain that controls movement, the motor section.
With the varying degrees of cerebral palsy, some children may have issues with comprehension or understanding. Others have seizures and problems talking, swallowing, hearing, or seeing. Despite the struggles, the possibilities are bright for children living in Jamaica with this and other conditions that affect the ability to walk. Medical interventions are now allowing some disabled children to walk for the first time and for others to walk better, ultimately having an improved quality of life.
I think what we have brought is a comprehensive approach to addressing the problem, where all the medical professionals, including nurses, physiotherapists, occupational therapists, the surgeons, the rehabilitation and specialists and physiatrists, and the neurosurgeons and neurologists have come together, working with the hospital, working with the pharmacists to try and solve the problems of each child individually. So it's not a one-size-fits-all. So for example, in my specialties, some of them may need a surgical procedure on the lower back, which we call a dorsal rhizotomy, where we will resect some of the nerve or divide some of the nerves to allow them to move the legs more freely.
Other options for treatment include injecting the muscles or around the nerves with medication that decrease muscle tone or muscle stiffness. These medications include phenol or botulinum toxin type A, Botox. Specialist teams at the Bustamante Hospital for Children and the University Hospital of the West Indies, along with partners from overseas, have been pioneering treatments for these children.
The children are assessed. They're assessed by the physiatrists, they're assessed by the physiotherapists, and a diagnosis is made, and then a particular treatment is prescribed that's tailor-made for that child's disability.
Assistive aids such as braces, walkers, and other orthotic devices provide important support to children dealing with spasticity and the pain or discomfort it causes.
It's important for children with movement problems to be positioned properly. Without good positioning, the stiffness can pull the joints out of alignment. And so when they're very early, we put them in what we call braces or orthotics. And these orthotics will maintain a proper alignment of the joint, preventing the ankles from being deformed, preventing the fingers from being deformed.
The braces help with standing, balance, and overall mobility.
If you start from toe upwards, you have what we call ankle-foot orthosis. AFO is the quick acronym. You have orthosis or braces that includes the knee, ankle-foot orthosis that allows for stability. You have some that we use at the hip to keep the hip apart. We use some at the elbows as well, or the wrists, so wrist orthosis. Some patients may require spine orthosis. Those are not usually used in the neuromuscular children, meaning the children with cerebral palsy and weakness. And if they are able to stand and balance, they get walkers to ambulate or wheelchairs so the parents and caregivers can carry them around comfortably.
There are several risk factors for cerebral palsy.
The risk factors include poor antenatal care. It also includes children that are born very young, premature delivery, less than 28 weeks, because the brain is very delicate, and any changes in oxygenation can affect the brain. Low birth weight as well when children are born very low. Different types of infections can cause it.
And even after delivery, there's the risk from head injury and infections such as meningitis and jaundice, among other things. Doctors say the risk of developing cerebral palsy can be minimized.
Parents need to know that you must have proper antenatal care, proper enough to take the pregnancy to full term, to 40 weeks, so the child's brain and body and blood vessels can develop properly. In addition to that, good health care condition for the mother, and delivery, safe delivery is always important, and postnatally, meaning after they're delivered, is to ensure that the children are healthy, they get their vaccinations, they're not exposed to any infection, there's no trauma to the brain, environment is safe, so you don't have exposure to chemicals that can also cause it, or to accidents or near drowning and stuff like that.
Children's exposure to toxic chemicals such as paints with lead in them, herbicides, pesticides, or household chemicals with pungent odors, either ingested or inhaled, can cause brain damage and must be avoided. Our best option for good health is always prevention, but that aside, effective curative measures offer hope and great joy.
We do have children walking who weren't able to walk before. We do have children sitting who couldn't sit before. I had a patient once where the legs were crossed, scissored we call it, where the legs were scissored at the hips, and the mother wasn't able to clean her properly or carry her. So when she used to carry her in the front. So we injected between the legs, and she came back. She was very happy. I'm like, why are you so happy? She's like, me can lap her now. I said, what do you mean by that? Because we injected between the legs, she could open the legs, so she could now carry her on the side, one foot in the front, one in the back, and a bag.
We hear of another story from Aunt Avia, who cares for her nephew Emilio.
His name is Emilio Morris. He's 12 years old. At one point, his foot was like turning like this. So now they cast it at the Bustamante. It said come back around straight. So now he's wearing a braces. At one point he used to creep, but now he doesn't creep. At one point his knee was very tight, but now it's not so tight. Things kind of better now, being that him get the injection. He used to get fizzy. They want him to stand up in the brace.
Kenil Baker is 13 years old. He was born with cerebral palsy, low motor skills. Basically, he cannot walk without assistance.
We have been coming to this clinic for some time now, where he has gotten injections and has done a surgery, which has helped him tremendously. He could not lay on his stomach. After the surgery, he was able to lay on his stomach and turn over, roll over. He's able to stretch out his hands and legs. And for bathing him, it has been made much easier for caring for him. He could not feed himself. He's trying to feed himself now. Well, you can leave him with food and he will feed himself. He's a very happy child. And we have good support from family and friends. And thank God we do. He's our joy. He's our joy.